All right, now I'm going to find my PowerPoint. There we go. Well, I'd just like to start off by saying good morning, everybody. It is a pleasure to be here. My name is Roberta Miranda-Alfonzo, and I'm going to be presenting some, I will call it Trauma 101, but hopefully be able to just present to you some terminology, some ideas on how to integrate some trauma-themed work and trauma-informed care with your clients and students. So I'm going to switch over to my PowerPoint. Boing, boing, boing. Oops, I guess I should share my screen first. Nope, we want this. Okay, so I'm coming as a representative of UNLV practice. And in just a minute, I'll just mention to you what the practice is, because we do have an existing just partnership, that hopefully we can continue to take to foster in this coming school year. And as Sarah mentioned, I did have the opportunity to present Trauma 101 to Humboldt County on Monday. So to be truly transparent, this is pretty similar PowerPoint. So some of the slides are going to be a little bit more catered to educators. I also thought, because you're primarily working with students in school settings, that a lot of it was very applicable. So I try to go back and change some of the slides, but some of that terminology might still be in there. So I'm just curious, though, who in here has heard of the practice, are familiar with our partnership? A little bit. Okay. All right. Cool. For the most part. So I'll talk a little bit about that. And then, because as we said, as we start the new school year, it's just so important to know what resources are available. Share my screen again. And so we are, just to kind of give you an agenda, we are scheduled from 9 to 11 today, and I will do my best to check for the chat box for questions. But certainly, because we're an intimate group, it looks like you all know each other, there's some familiarity, feel free just to stop, make comments, add suggestions. This works for me, have a question for one another. So I really want to just promote as much engagement as possible as we work through some of the material. And even though it is relatively 2 hours is still a training, but we definitely will have a break in the middle, just so we can stretch, eat, and then come back a little more refreshed. That is the plan of attack. So to tell you a little bit about UNLV practice, the UNLV practice it's a mental health and behavioral health community training clinic that has a mission of contributing to the workforce of developing mental health professionals, and at the same time providing quality and affordable mental health services to Las Vegas and rural Nevada community. So what we do here is that we train master level clinical mental health students, clinical psychology doctoral students, school psychology masters and doctoral students, as well as postdoctoral psychology fellows, especially in the area of supervision, to provide the best practices under teaching, clinical supervision, and licensed faculty. So in some, we are like an interdisciplinary training center for our master's or graduate level students, which is really kind of cool, because oftentimes we see different types of graduate programs pretty siloed into their own programming and their own philosophies, where here we meet regularly. As far as like supervision, we pair students from different disciplines to co-facilitate groups. We do all kinds of training, so then they can learn from each other and just really appreciate and recognize each other's expertise. So it's really, quite fun. And what the practice actually stands for, and I still haven't memorized this yet, even though I've been part of the practice for a few years, is the Partnership for Research, Assessment, Counseling, Therapy, and Innovative Clinical Education. So there's a couple of pictures there. We have our initial main clinic there at the UNLV campus in our CEB building. Counselor Education, Carlson Education Building. And just this past year, we opened up a new satellite clinic off of, if you're familiar with Las Vegas, on the west side of town, where we are very youth focused. So this is where we're going to do our assessments, our groups, our individual sessions, potentially our CIS telehealth sessions from this new satellite clinic. So you can see there where you kind of see a sun that represents like one of the rooms. So we are really um, just intentional about making it very bold, youth focused, warm, and inviting. So, and I serve as the youth program coordinator for this new site. So very excited to be part of it, to grow it. So when I mentioned telehealth, so if you're not quite, the reason I'm just spending a little time talking about the practice is that we have a CIS contract in which we are able to provide clinical mental health services to many of your students at your schools. And the reason we're able to do that is that we have the ability to do telecounseling or telehealth. And so Dr. Nixon here, Dr. John Nixon is our coordinator for this. And so he would be the main contact. However, I can certainly do my best if you have any questions as far as referrals and how to refer your clients for telehealth services, I can get you that information. But the way that it's been set up is that once you have a referral, that your home school should have the capacity to set up a laptop or a computer to connect with the telehealth counselor at our side. So the student isn't required to have their own laptop, their own internet services. Part of the contract does provide that service for the student. So because mental health providers are so limited, especially in the rural areas, this is just a great opportunity when you see that a student might need that extra support. So any questions about that, about CIS or the mental health program? And again, and if you do have any additional questions, just I'll give you my email address and I will hook you up. So just a little bit about me. As I mentioned, my name is Roberta, and I am the youth coordinator and one of the clinical supervisors here. So I work directly with the students. I co-facilitate groups with them. I monitor their sessions. So that's just to really help. I love just guiding and promoting our new workforce. As far as some of my trauma background and taking tenets of what I've learned, I'm trained in trauma-focused CBT. And personally have worked over 10 years clinically with adolescents, primarily through the juvenile justice system. I'm what they call a LCDC supervisor and CPC supervisor in Nevada, which means that I work with postmasters, individuals seeking licensure. So I do that on the side. And also, even though I haven't taught in elementary school or high school, I have been teaching college students for some time. So I kind of know a little bit about managing some student concerns over the years. And then as far as personally, my background's in counseling, and I just plugged in a picture because I'm like very excited because I just graduated with a PhD in counseling just in this past June. So it's a picture of my son and I, and very exciting moment. So because you can tell, I love counseling, the field of counseling. So what are the goals for today? The first goal is just a review because many of you have already trained in trauma-focused care. I find that it's always good to revisit some of the terminology, some of the signs and symptoms, especially as we come in from the summer, and it just gives us a more focused lens on working with them in the schools. We're going to learn the framework of trauma-informed care and some of just again, its tenets or domains. And then we're going to talk about creating an emotionally corrective space, because one of the main reasons in talking about this, especially with all of you, is to recognize that when we are presented with potential trauma with a student or a traumatic situation, that we maybe you don't need to have the philosophy is of this is out of my scope of practice. Let me immediately refer to a mental health clinician because there's a lot of other work we can do with that student in those moments. That maybe doesn't warrant that next step. Maybe it's just work is just sitting with the student. Maybe it's just creating a safe space. And that's what we're going to talk about. What are some little things that we can do in our own capacity that can really attend to some of these areas? And then I have some slides that talk about the importance of taking care of ourselves as a helper, because you're working with a lot of stressful situations and hearing a lot of just perhaps sad stories and just really experiencing a lot of feelings in the type of work that we do. And so just some tips and some ideas, brainstorming on how to just keep ourselves well as we do this type of work. So that's the plan of attack for today. So let's just jump into it. I got to move this so I can see the screen. Okay. So why discuss trauma? So like again, why do we have this? Well, hopefully by the end of this workshop, that we can, as a group, really remove some of the stigma associated with the terms pertaining to trauma. Because I know for some, like we hear trauma, we think, oh, scary, or we think car accident, or we think school shooting, something pretty big. And the goal is to actually recognize that there's going to be those big T traumas, and then there's going to be those little T traumas. And it's those little T traumas too, where we can have some ability to intervene and provide support. So in simplistic terms, to hopefully make the term trauma a little less scary for all of us. To encourage all providers that we can still approach discussions surrounding trauma, that this does not need to be just for the roles of the mental health providers or the social workers or the mental health staff at your schools. And within this is to increase awareness among your fellow educators, your administrators, even the students themselves. So there's some familiarity with this, as well as their families. To hopefully encourage a trauma-informed culture, which we'll spend some quality time on. And then bottom line is to hopefully try to facilitate a supportive and calmer classroom and class and school experience. So then it's inviting for not just the students, but for the educators and for everybody involved to provide a supportive environment. So thinking about trauma, I couldn't believe the statistic, like when I actually think about it, that approximately 2/3, so 2 out of 3 children in the United States experience a trauma before their 18th birthday. So it really is quite prevalent. Rates are certainly higher for our students of color, and I wouldn't doubt if we explored some of the rural statistics that those levels might be really high as well. Approximately 1/3 of children experience at least 2 types of more trauma before their 18th birthday. So it's oftentimes not the students, sometimes we think it's the students who are acting more impulsively or acting out that might be exposed to trauma, but chances are there's quite a few students in any classroom that might need support. So as you're thinking about school, you're thinking about the classrooms, maybe thinking about programming. I don't know if it was Rowena who mentioned that, like, I just kind of want to go in with an intentional lens of how can I assess for potential mental health. And so these are some common trauma responses in children that probably won't be so surprising, but just to refresh, this is what you might see or what your educators, your teachers might report to you as far as what they see. We might see regressive behaviors. So just retreating, maybe starting to act a little younger than their age or their peers. Certainly some anger and aggression could be common. Avoidance and social withdrawal. And we might see a little bit more of this coming into the school year because of the pandemic, because we've seen just a lot of students really kind of go into their shell over the last year or two. So really trying to help acclimate them into a social setting again. We might see inability to concentrate, so lack of focus, depression, irritability. We might see those students that worry a lot, anxious, fearful. With our younger students, especially, we start to see like those physical complaints. I want to go to the nurse. I've got tummy aches. This hurts. My head hurts. Because sometimes they don't have the language or maybe the understanding of what might be going on for them emotionally, so they can express themselves through physical um, support. And some self-blame too, like just really like it's all my fault kind of thinking. And just to remember that not all children who experience a traumatic event will necessarily develop a traumatic response. So each student is certainly different in how they respond to trauma. So in thinking about students, you've been in the classroom. There's a lot of activity. There's the school bell. So all of this is going on, and so we might see a lot going on, and it's really a lot for us to kind of keep track of because it's the students that are maybe throwing the paper airplane or just being a little bit more external with their behaviors are going to catch our attention. And so what we also want to think about are are some of our quieter students going through as well. So if we think about the classroom, it's really easy to pay attention to the disruption, but it's also important for us to think about like, what about the student who's not eating? So what about the student who's going to the cafeteria and they're just picking at their food, or they're throwing away their brown bag lunch on a regular basis? Could be something to pay attention to. Or they're just not engaging in classroom activities. They're just not interested. They are uh, it's hard for them to socially connect with their peers or with adults. Perhaps with our younger students, there's some separation anxiety. So they get stressful when they have to start their school day. Maybe they're clingy with their parents or their caretakers. There's just some insecurity about coming into the school setting. Students that maybe are easily startled. So the door slams and ooh, they jump in their seats, or they just are just very responsive to the outside stimuli, maybe more so than than most students. Even things like maybe daydreaming. We don't always think of like the student, who's we kind of think like, oh, they're creative or they're in fantasy land and hello, come back, come back. This could be an indicative of disassociation. This could be a lack of focus. This could be just there's a lot going on for them internally that and this perhaps encourages them to just tune out. Um, and then just a caveat, not to say that if you see a student daydreaming, it automatically means that there's trauma. It just means, you know what, I'm going to check in with the student and see how they're doing. Sexualized behaviors, restlessness during learning times, impulsivity. So the students that blurt out things or really find it hard to stay contained during events and other school classroom activities. Students who are quiet, maybe don't want to talk, or just like refusing to do things. And of course, yeah, children who might be a little bit more assertive and start fights with other children too. So the key piece is to also just look at some of those quieter responses that can be easy to overlook, and maybe even talk to your teachers in the classroom to say, "Gosh, yes, we know so and so, it has been a little disruptive. Anything else you've noticed in the classroom? Maybe somebody else I can just touch in with. Anybody that just looks out the window while you're teaching. Anybody else that just seems unfocused." That they're kind of behind every time that you present something, because that might be a student to connect with. So when we think of trauma, like I mentioned, there's bottom line is trauma means it's a violation of a sense of safety and security that interrupts a child's safe haven. And in the field, and probably in your training, you've heard of this too, there's this idea of a big T trauma and little t trauma. And not that little t is anything to minimize or to say, well, that's not as important as big T. It's just a different terminology that could still result in the same type of physiology and emotional outcomes. So when it comes to big T trauma, this is a reaction to a deeply disturbing, life-threatening event or situation. So this is when we sometimes think of trauma, we think of these extreme events like war or natural disasters or school shooting or a big car accident. Those big T traumas. Chronic big T trauma is the result of repeated ongoing trauma, such as like abuse or sexual abuse or domestic violence. Um, and just as a quick aside, too, for trauma to be considered post traumatic stress disorder, the symptoms must last more than a month and be severe enough to interfere with daily functioning. So, in that, we just want to be mindful that we don't attach the diagnosis of post traumatic stress disorder just because a student maybe went through a car accident or that they've been exposed to some sort of trauma. They actually will have had to meet criteria of just some different symptoms during a certain duration of time. And the fact that it's going to be really hard for them to focus at school and have daily functioning. So just a quick aside, because a lot of us kind of use that terminology, even just jokingly, but just to say let's just to differentiate PTSD and trauma. So those little T's, again, still a violation of a sense of safety and security that interrupts that child's safe haven. And little T's is probably oftentimes what you're going to see pretty commonly with the students in the classes that you see. So little T's include any events or ongoing situation, or even a combination of compounding situations that causes distress, fear, and oftentimes a real sense of helplessness. So, little T trauma might be the result of a romantic breakup. So, think of like some of our middle schoolers and our high schoolers specifically. When they break up with somebody, oh, like they feel like they feel distressed. They might feel helplessness. They might feel low self confidence. They might feel like, oh, it's just my heart's broken. There's sadness. There's maybe fear that nobody's going to like them again. There's a huge emotional response to a romantic breakup. And so remembering as helpers that we want to attend to it, validate it, be present to it, because sometimes as adults, seeing things in retrospect, we could easily say like, gosh, yeah, but you're going to meet so many more people, or it's, you'll be fine by tomorrow, trying to make them feel better when it's really helpful to just to honor the feeling. Sometimes just sit with them and say, oh man, that is really tough. And it does really hurt because that's going to help process some of these feelings. With some of our students, we see bullying, we see virtual bullying, we see, especially now, oh my gosh, I'm sure all of you have heard students talk about social media and sometimes what other students tell them, not to mention what might be going on in the schools. So again, that distress, that fear, that sense of hopelessness, it really affects the ego, and it really affects how they might start seeing the world. Microaggressions. So if we work with students who come maybe from a different cultural background, maybe they come from a different financial background, and they wear the same clothes 3 days in a row, and they get picked on. Just those continual microaggressions are little traumas, little T's. Financial distress, so seeing what parents might be going through at home, seeing the distress of what's going on at home, that secondary trauma is a little T. So trying to say that all of these big T, little T's, they have oftentimes very similar impacts on brain development. And not to get too technical, with parts of the brain, that these trauma, they induce these changes that impact the degrees of cognitive ability and emotional dysregulation. So it's not that the student who is disruptive is because they want to be disruptive. oftentimes it's because as far as their brain development, that they haven't yet, they're delayed in their ability to manage the emotion. So that's why you might see an 11-year-old kind of lash out like a 3-year-old. There's been a delay in development, oftentimes because of the impact of the trauma they were exposed to. This can also impact focus, learning abilities. There's even some research that supports there's a link between early trauma and ADHD, speech development, social skills, and of course, if there's sleep issues, or the student's not getting enough sleep, and then they come in with already some of these other areas of just concern, then it's going to be really tough for them because it's going to perpetuate the situation. So the small T traumas are events that exceed the student's capacity to cope and cause disruption in the emotional functioning and brain functioning. So even though they're not bodily integrity threatening, they're more ego threatening due to the individual feeling notably helpless, shameful, humiliated, sometimes after a breakup, or feeling bullied. There's a feeling of shame and humiliation that is internalized, and can result in some of those behaviors that we talked about a little earlier. And then one of the resources too is just going back to COVID-19. I'll give you this. Oh yeah, I'm recording. For a minute, I forgot that I was like, yes, I'm recording. I'll give you the PowerPoint as well with this link because I didn't want to just take all this and put it on a PowerPoint. But this was just released March 31st of this year. There's new CDC data that illuminates youth mental health threats during the pandemic. So just based on the survey of high school students during the pandemic, we could take some of this data to really inform effective programming at your school. So thinking about what are some of the needs, like a needs assessment in a sense. So this is kind of a needs assessment done, that's already done that maybe you can pull from. That school connectedness provides critical protection for students during COVID-19. So the school setting is primarily what they get a lot of their emotional needs met, especially when it comes to the social connectedness. So thinking about it, it says there, youth who felt connected to adults or peers at school were significantly less likely than those who did not represent of feelings of sadness or hopelessness, or even suicidal ideation. It's that connection during this age that really can make a difference. So thinking about how can create peer support within the school system or the school day. Some of the other areas that they talked about were that more than half reported emotional abuse by a parent or other adult at the home, including being sweared at, insulted, or being put down. And most was most likely related, to COVID-19, right? We were kind of all isolated together, stress, maybe loss of job, maybe loss of just the activity, outside activity. So there was just a lot of stress going on within the households. And unfortunately, a lot of our students were the recipient, of some of that abuse and some of that stress. 11% reported actual physical abuse. And then just talking about the financial impacts, like we were talking about, that there were probably some decrease in income because of the pandemic. So just so much that we can, and this is just a few, like when you talk to your students, probably say like, gosh, yeah, like I miss my friends, or I miss being able to do this, or I just feel bored, can't go outside, can't do anything. So thinking about some of this as they come back to the school setting, might help guide you with some of those, the initial assessing and maybe ideas for programs. So, any questions so far? I'm just going to stop here for a moment because you've heard me talk a lot, and I know it's a lot to listen to all at once. Or how about comments? I don't know. Have you already experienced, just some of the impacts of COVID-19 with your students? And if so, what have you seen?
We've I feel like we've seen it at the high school level. like last year, everybody was pretty much back full time with lack of social skills and development. Like they are a year or two behind with
Mm,
their social skills and things like
mm.
that. So our freshmen kind of were more like seventh graders because they had
Wow.
missed so much over
Hmm.
that year and a half. So I see we saw it there.
You saw it. Yeah. And I'm wondering, and it's Rowena, correct? Rowena?
Right.
Rowena, it,
Yeah.
what, what helped over the school year? Or would you say did anything help over the school year, help them acclimate back to being in person?
I just being there and being around friends and being around teachers and staff and getting into a routine of school and what do I do, what do I don't do, things like
Hmm.
that. I think a lot of it was just finally being back at school and
Hmm.
being around their peers.
Yeah. So just being back, being around other young people, getting back into a routine, because that was another thing with students when working in the counseling field.
Mhm.
Parents would say, "Oh, they're sleeping till 2 o'clock in the afternoon. They're just their structure is completely off. They're staying up. Maybe they'll show up for a Zoom class and then go back to sleep." And so just routines were really thrown off for that time. So it sounds like that structure of school too was really helpful.
Yeah, consistency.
Hmm. Absolutely,
Yeah, and
consistency.
then teachers and people who cared about them, the
Mhm.
teachers who cared about them,
Mm.
CIS, just everything like that.
Yeah, thank and I'm so glad you said that because that was going to be my next point, the impact of the educators, the CIS, yeah, all of you, uh, just the importance of having a person in their life, see it, recognize it, and yeah, just care about it. Honestly, is just be caring and be empathetic to the situation. I also hear in that there's a lot of patience. Like, wow, these are freshmen, they're acting like seventh graders and just going with the flow, like understanding the reason behind it. That's very trauma informed to recognize there's a reason why they're coming in and acting like seventh graders. They've been home for 2 years. So that's the patience and the support that the trauma informed culture really embraces. So thank you so much for sharing. Let's say we have about 15 more minutes and then we'll take our break. So that's exactly, whoa, perfect segue. Oops, I'm looking at my PowerPoint, but I don't think you're seeing it. Oops. Come on. Sometimes Zoom doesn't like to, there we go. Go back to the main screen. Maybe if I minimize this, there we go. Share my screen again. I'm just looking at the PowerPoint by myself. Okay, from current slide, there we go. So exactly talking about what is trauma informed care, because I know for me when as a counselor, this is a relatively newer term, and sometimes I would say, "Oh," or be asked, like, "What's trauma-informed care?" and or "This is a trauma-informed care model." I would be a little curious, like, "What does that mean?" And it sounds a little intimidating. And how much do I have to be trained in trauma therapy to adhere to a trauma-informed care model? And it was really over the last couple of years, stemming from the pandemic, to when I recognized, oh, trauma informed care is exactly kind of what we were just talking about. It's just really a shift in thinking, a shift in culture from what is wrong with these students coming in acting like seventh graders to, wow, what has gone on in their lives that has stunted some of their development, that has impacted their ability to socialize. So really, it's a shift in approach to recognize that trauma or some sort of trauma exposure might have had some impact on why a student or an individual is behaving the way they're behaving. To really move away from kind of a punitive, accusatory, like, oh, that student's acting out again, or oh, like these kids, like they're just out of control, and more to, okay, there's a lot going on here. There's a lot of energy here. There's most likely a lot of pain coming into this experience, which could be causing it. So that really is the idea of kind of trauma-informed awareness, to think about what is it about what could have happened to the student outside the situation a negative experience that could have contributed to this. So it's recognizing that the presence of trauma symptoms, like we talked about, those lists that we reviewed, and acknowledging the role that trauma or little t, big T might have played in their life. And then in that, knowing what can be done to not say, okay, that person might have experienced trauma, but out of my scope, so that's somebody else's issue. But to recognize there's something we can all do, even if it's I have a brochure for a mental health therapist in the area that I can provide to the student, or I can just check in with the student, or I can connect a social worker with the student. So just knowing what that there's an action I can do, or even have the knowledge of what I can do if this is present. And then this is going to hopefully change the organizational culture. So if I talk about it, then I could talk about it with my colleague, then I could talk about it with with the teacher, I could talk about it with parents. I can really just kind of create a culture that um, minimizes the stigma of trauma and talks more about self-care, or talks about wellness and care and improvement. And also too, trauma-informed care helps to actively avoid re-traumatization, to be very intentional about creating safe and secure spaces. So this is where we might want to educate our teachers to not yell to bring the clients back to the students back to a quieter state, because yelling might trigger a student because maybe their father yells at them. So teaching and presenting to students, like, what are other ways to bring down the activity in the classroom without yelling, or without not that any educators would do this, but just in extreme examples, like use names or labels, or to do anything that's more punitive. So to really try to do our best as a whole to create a safer environment. Even if it's can get a little chaotic because they're kids, there are ways to still manage the classroom, hopefully, without presenting, these maybe harsher tones that could create re-traumatization. So, quick exercise before we uh, break for a little break is, as we think about our class and we go back into the new school year and kind of what is our role with each of the students, it's really nice to tap into our own childhood experiences to really relate to what was it like being a kid. And in this exercise, if we could just take a moment, breathe for a second, and think back in our own childhood, and think back when we were a student, and try to remember who was one of our favorite teachers. Uh, so maybe, for me, I like to do a little scan, like kindergarten, first, second, third, fourth, fifth, yep, sixth, seventh, eighth. So just a quick, like just scan of like who stands out as one of your favorite teachers. And when you do, somebody like sticks out to you, an individual, think about what was it about their characteristics? Uh, what is it? What were their behaviors? What did they do that just, that you really admired? And then in further thinking about it for a moment, thinking about how did you feel about around them? So if you interacted with this teacher, or you stayed after school, or you had a parent teacher conference and this teacher was there, what were some of the feelings that you experienced around this teacher? So just to quickly stop for a second and using the chat box if you'd like, think about what was either the characteristics or the experience for you when you think about this teacher. So can most of us think of somebody in our past that stands out to us as a favorite teacher? Yeah, totally. Hmm. Thank you. So someone said welcoming. They actually truly cared. Yes. Believed in me and pushed me to do my best. Great sense of humor, made learning fun, helpful, funny, and kind. Thank you. She was very patient and kind, and you could just tell she loved her job and her students. So she exuded passion and kindness, energetic, engaging, friendly. And I'm just like, I'm reading this and I'm smiling because it's like, yes, like there's just these amazing people out there in the school setting that really made the school experience different for us. Um, thank you so much, for filling it in. Yeah, and for me, like when I was thinking about this exercise, I kind of did the scan. I stopped for 5th grade, and I always think of Mr. Douglas. And I went to one school for 9 years. It was a small school in California, and I went from kindergarten to 8th grade. Same school, 9 years. So it was pretty small um, school body. And I stopped at Mr. Douglas is one of the few male teachers we had in the whole school. And he was tall and Caucasian and almost looked like a Viking, So it could be very intimidating. And I remember at first thinking, like, he's intimidating. And my gosh, Mr. Douglas was funny, as somebody said, had a quirky sense of humor. I always remember he would pull out the coolest movies when it was a rainy day. Like all the other students had to watch something educational. We'd watch like Back to the Future or something. I'm showing my age. And but when I think about him, he was so, I felt so I felt seen by him. So when he was tall and I was small, like when he would talk to me, even though he had a broad presence, he would sometimes lean down, like on his knees, and talk to me, just on a personal level. And he could pay full attention and tell me what I was good at, and just take the time to, like somebody said, help me believe in myself. I remember when my mom and came to the teacher conference, and I was still shy, and he just was raving about what a good writer I was, and what an awesome student, and all the potential. And I just felt my like self, just like my ego, just like come to fruition, just because I was so excited. Because at home I wasn't getting a lot of affirmations, so just to be felt, as far as my experience, I felt seen, I felt cared for, I felt heard, and I felt special. Yeah, and I always thank Mr. Douglas for that, because it was going on in a time in my life where there wasn't a lot of things going on at home that would make me feel the same way. So that one person, and I can remember this, I'm almost 50 years old, and I can remember standing there with him in the feeling I experienced. So the reason we're going through this exercise, is to remember that it could be one person, it could be you, that can make a big impact on a student's life. That could be life changing, life impacting, and could be right at that pivotal moment where they really need it. And it's just by exhibiting your own characteristics. So it's not, I'm a trained mental health therapist. It's like, no, I'm kind. I'm smiling. I'm giving eye contact. I'm passionate about what I do, and the students see it. I care about the student. And then that just really let the student be seen. That in itself is so powerful and so trauma informed, and something that you can do, and something that you can even hopefully influence the teachers in the room to do. Because sometimes there's burnout, sometimes there's so many students, or I can't attend to each and every one of them. That could be true, but sometimes all it takes is a smile. Sometimes all it takes is that one moment during the week to say, hey, just want to let you know I see you. I saw what you did. I saw your improvement on the paper. And it can make such an impact. So this is powerful. So I really, that's why I like to do this little reflective exercise, to think about what are characteristics that I can tap into myself, that I can show students, and recognize that that can just have such a huge bearing um, on their lives. So, well, thank you for engaging. So let's go a couple more minutes and then we'll take a break. So tapping into it is thinking about what can I do to attend to students? And we can tap into our empathy, not sympathy. I'll talk about that when we come back. Noticing students to help them feel less invisible. To develop relationships, to create a comprehensive approach. So this is not to say put all of the pressure on yourself to do everything, to use each other, to use to pair up with other colleagues, to be a team, to work to work with students. Be a source of resiliency. So remembering that in order to be able to tend to our students, we have to take care of ourselves. We're modeling resiliency to students. We're modeling self-care. We're modeling just even the way we come into the school, our mood, or everything. Students observe us. And so we want to model that resiliency. But to be able to do that, we've got to take care of ourselves. Avoid putting pressure to say the right thing. Because sometimes when we approach somebody who's been bullied or is going through a tough time at home, we think, oh my God, I don't know what to say, or what if I say the wrong thing? And it's really like, if we can just be genuine and just like, hey, how you doing? Or man, that's tough. Using your own language, your own presence, that's more important. Being genuine and authentic and present is more important than the words. Being familiar with community resources. So know when students do need that extra support, you know how to bridge that. And like we said, remembering that one adult can make a difference. So this is a good time for a break. So when we come back, we're going to watch a quick Brene Brown video that's so cute. It talks a little bit about empathy. And then we're going to talk about what can we do to create the space in the school that can help promote a trauma-informed model. And then we're also going to touch a little bit on the different pillars of trauma-informed framework. So we'll come back and we'll tackle the rest. So I'll see you back at, say, 10 o'clock. Okay, see you shortly. All right, well, welcome back, everybody. Thank you for coming back for part two. What I'd like to do is just take a moment and watch about a 3-minute video that was put out by Brene Brown. I know some of you might be familiar with her work and might have even seen this video. And it's one of those videos that I just could watch and over again. I think it's just so cute. And what I love about it is just that she talks about just the idea of empathy, because that really ties into our trauma-focused culture in trying to shift the why is or that person is acting because of this negative, you know, insert adjective here, but there could be another reason behind this behavior. So really tapping into trying to understand, striving to understand reasons why our students might behave the way they do. And when we're working with them, to tap into our empathy. For many years, for 8 or 9 years, I worked primarily with adolescents referred through the juvenile justice system. And sometimes I go into the detention centers and went into like the Alco and Caliente detention centers. And so would work with individuals that came from pretty harsh backgrounds and would engage in pretty harsh criminal activity. And so, and able to be able to work with them, I had to really tap into the empathy piece. So they might have maybe engaged in a house invasion. They maybe had gun possession. Maybe they beat somebody up. There are all kinds of things, that they were there for. And so to be able to connect with them, as an individual, I had to really tap into something to say, okay, what is it behind this facade that maybe could have led to this? Who is the human behind all of this? So it takes intention and time to kind of work through this. But then when we're able to, that connection can happen. And so that's where this video kind of comes into it when we're working with students from a variety of backgrounds. So I'm going to share my screen, and I just love this video. Share the sound, and hopefully it should come up, but that's not it. Oh, I had it ready. There we go. Boop. There we go. So hopefully you can see that. And I'm going to adjust the volume on my end, so it's going to be a little louder for you all. So feel free to put the volume down if you need to, just so you can all hear it.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Oh, I just love the message in that. Short and poignant. It's just, and I especially love the point of like, it's often rarely what the words that we choose, but it's our presence. It's our willingness to be there for somebody that can make a big difference. So Brene Brown has some good work out there. So let's continue on from current slides. So thank you for watching. All right. I'm like, my face is blocking what I can see. So, so the idea of connection, there's a term that we use too. It's the idea of emotional attunement. So being present and aware of the child's emotional needs, recognizing that children are wired to act before they think. So we have to think just physiologically, brain development wise, that they really haven't yet gained the skill set to always emotionally regulate, that there's more oftentimes behavior than the, oh, okay, I'll sit down. And the emotional attunement, part of that role, or just the role, is to create psychological safety that can help increase student engagement. So that heightened awareness is really that emotional attunement, that we can do from afar, or even when we're working on one-on-one with students. Yep. So these are the pillars. We're going to go through each one of these. So if we're thinking about framework, this is what the trauma-informed care, the tenets or the pillars look like, or they're comprised of, is the idea of promoting safety, trustworthiness and transparency, promoting peer support, and that's for students and for ourselves, collaboration, humility and responsiveness, and empowerment and choice. So we'll take a quick look at each one of these areas so we know the framework. So safety. So when we're thinking about our own offices, or we're consulting with our teachers, that we really want to try to create a space that's for students that's both physically safe and emotionally safe. So emotionally, this is where we create that kind of energy coming into the room, where we're modeling respect and kindness, like we talked about. It's calming in nature and comfortable. So in the room, we want it to make it inviting and warm. So rather than kind of cold and just fluorescent lights, that's going to create it's not going to create as a safe a feeling as like a warmer, especially age appropriately. What's nice is just if you're thinking about like maybe decorating your room or consulting with students or with teachers, is like maybe including books that include like social emotional literature. Our younger students are pretty impressionable. Like if they happen to see a book on divorce, on your bookshelf, there might be some curiosity, like, oh, there's a book on divorce, or there's a book on depression for kids. So it just opens up dialogue. Feeling charts. I mean, those are sometimes nice for children who are still developing the language to identify, feelings, but beyond angry and sad. So finding some of those charts that you can find like on Amazon or some other psychological websites, that just say like, okay, if you're going on this feelings list, how would you identify yourself today? So it creates the conversation and the language. For teachers, maybe to create a safety is to practice a check-in and a check-out with everybody, the students at the beginning. So just checking in, getting a gauge of how everybody's doing, doing a checkout before the bell rings. So just promotes that interaction. And then maybe even just in your office, creating a little corner that's like just very sensitive to the age. I went to an open house a few days ago of a new agency, and they have, like, they call it like the calm room. And so they had things in there that were very tactile. Like you could like touch things on the wall that felt like rubber and carpet. And then they had like uh, weight blankets that they could put on, and they had like beanbag chairs. So things that are very tactile, just kind of would help some of the students feel comfortable versus just like the hard chair, perhaps that may not be as comfy. Trustworthiness and transparency. So being able to making and implementing decisions with the goals of building, maintaining trust between all of you and the community. So how do we build trustworthiness and transparency? Well, I think as Rowena mentioned when she talked about the students coming back to school, is being consistent. So making sure that students know what expectations are. Structure, just like we were talking about with students coming back from COVID-19, where there's maybe been some poor structure. Most students will thrive on a schedule and a structure and know what to expect. As an educator, teaching college students, I used to have the philosophy of I always, have to be spontaneous and make it fun, and maybe I would teaching counseling students, like kind of throw an activity out of the air, like surprise, we're going to do this role play. But what would happen is that it would backfire, because all it would do is it sometimes create anxiety. It would create like, oh, fear of like, what does she want us to do? I didn't know we were going to do this coming in. And I started to recognize that kind of my spontaneous, random activities weren't always the best thing. So what students liked is knowing the agenda, at least at the beginning of the class. This is what to expect for our 2 hours together. So providing structure and consistency can promote safety and transparency, as well as maintaining boundaries and learning how to assess communication. As we've talked about, what are some things to think about with our students coming back from the pandemic is recognizing that importance of peer support. Because sometimes students can use those shared lived experiences of trauma or difficulties to connect with each other, because that helps to build collaboration, safety, hope. So maybe creating some sort of support or student focus groups. Maybe thinking about some student academic groups or social groups that are already in place, and how you can bring a mental health element to it. So maybe working with the student body president and some of these other activities where there's maybe an introduction to a self-care day, or what does it mean to deal with stress, or what is it like to have or maybe bringing in a guest speaker. So ways to help just kind of have the peers support each other. And then on a parallel process is having you all connect with each other too, so you don't feel alone and having to navigate everything that's going on. That's where that collaboration comes in. So that's why it's so great to have such a group of you today, because this creates a collaboration. So you'll all have the same language. You'll all recognize what a trauma-informed culture looks like and might feel like. You might be able to brainstorm. So where nobody's reinventing the wheel on their own. There's just opportunities to just create that space as a collaborative, and then maybe even tying in community resources. There's even opportunities for trauma care teams that that are maybe are intentional about we're the trauma care team for our school, and this is we're going to present presentations like this to our parents. We're going to talk about trauma with our high schoolers. We're going to have posters in the hallways about mental health. So sometimes it's nice to even have a selective team do some projects. Empowerment and choice is really important. So whether we're working with students one-on-one or we're consulting with our educators, is to recognize that each student is coming in from a different background, and we want to recognize the uniqueness and not do a one-size-fits-all. So when I work with a class, I always kind of get a gauge. What are their interests? What is the kind of the personality of this group? And how can I tailor it so that there's more engagement and feedback? So there's more of a say in how we run the class together. So it gives hopefully individuals or students a choice of how to share, how much to share, that their opinion matters. Using opportunities to give choice. Would you like to come in Tuesday morning or Thursday morning? That's a choice that we can use to promote autonomy and empowerment, especially for students who come from a traumatized background and they don't feel good enough, or they don't know, or they're not used to finding their voice. There's an opportunity to engage and promote and provide opportunities where they do have a say. Would you like to look at this book or this book? Would you like to talk outside or inside? Those little things matter. Another thing that we do in counseling, or one thing I do, is ask permission, because that in itself implicitly kind of suggests empowerment. Would it be okay if I offered you a suggestion on how to get tutoring? Would it be okay with you to give you some ideas on college applications? So that sounds formal. It sounds like, gosh, of course. I mean, that's my job. But there's something about that intention of asking permission that puts that student in a more empowering position. Humility and responsiveness. So this is recognizing biases based on racial, ethnic, and cultural differences. So we want to do our best to check our own biases. So we don't engage in microaggressions unconsciously. That we want to provide a safe environment from students from all backgrounds. So we can do this by going to trainings, doing our professional development, doing some self-reflection work, and learning just to be an ally and an advocate as best we can. And knowing that we can't know it all, knowing that I'm striving. I just went to last Friday. I went to a GBLTQIA webinar with a focus on adolescence and substance abuse issues stemmed from the pandemic. It was a mouthful. And I walked away learning new terminology, that I will fully admit that I was not familiar with. So there's always areas to learn and to grow from. And the key piece is to do this to create as much safety as possible. Oops. So, and thinking about how we can translate some of the trauma-informed pillars to the class or the school. These are some just management ideas or strategies that maybe you can sprinkle into your own office or consult with your colleagues about implementing in the classroom. So the idea of creating a roadmap, using praise and the power of it, and shifting that mindset to focus on the positive, which isn't always easy. It really isn't, especially when you're exhausted and there's a lot to handle. And so when it comes to your space, when it comes to the classroom, first of all, I'm not coming in here saying, this is what you need to do. I'm the expert on trauma. And so this is how you have to navigate the class. Absolutely not. My goal is just to come in with ideas that can be sprinkled into the class, because everybody here is already an expert. You know your student body. You know what issues that are more prevalent. You know what your students respond to when they come into your office. So trusting yourself to be able to facilitate it. In that, just to also recognize that the power of modeling, like we talked about. So recognizing today, you're like, oh, I didn't sleep well all night. I'm feeling crummy. I had an argument with my spouse, and now I've got to show up to work. And I come in and I'm disgruntled, and maybe I close the door behind me and I pull down the shades. It's like, what am I modeling? I mean, we can all have rough days, but we could also talk about, like, all right, if I come in, maybe if I take a few deep breaths, maybe if I connect with a colleague, I'm practicing self-care, and in that modeling self-care. So we have a lot of student eyes on us. We can also in that model healthy problem solving. We're human. Things happen. We spill something on the floor. We stay calm. We pick it up. We're working with students that sometimes at home, somebody drops something on the floor. Holy moly, watch out. Her parent can get very upset. A student could get punished. Arguing could happen. And we want to show students that that's not the only way to solve problems. We can model healthier ways to attend to it, still be human, still exhibit discomfort, but other ways to solve issues. And then, of course, we talked about recognizing when to connect with supports when needed. So, in thinking about like just structure, whether it's kind of like even for you, like say you decide to run a group for students up here, like a group on communication skills, or maybe on dealing with stress, that rules are important. Students respond to structure and boundaries, and it creates safety and trust. So even now I run groups for substance use disorder issues for adolescents. And the very first thing I do is set ground rules, but I also ask for ideas on what do we want our ground rules to be. So we want those expectations to be out there, be collaborative, but also we want to stick to them. because that creates that safety. It also allows that the rules to serve as a foundation of how your class or how your groups, or even just like how your sessions will operate. It can help reduce behavioral problems, of course, because your students know what to expect. So if you're saying no over talking somebody else, then students know from the very get-go that that's part of the expectation. And it helps create that I can never say this, predictability and security. So for some of you who maybe run groups, or you plan to do some programming in the schools, and you're putting together some guidelines, and you don't have to use the word rules either. Some use guidelines. Some will say like these are even something funny like Roberta's rulers. Just something that's where there's a clear understanding of what the expectation is, but to keep rules to a minimum. So we don't want to list 75 rules because that's just too much. That's overwhelming, and we want to make it simple. So students from all learning backgrounds totally understand. There's no confusion. We also want to make sure that we explain why there's the rules that we roll. It's not just because. There's a reason we don't overtalk over each other, because we want to hear each other. There's a reason we don't put our cell phones on when we're in group together, because then we're not paying attention to one another. We might be missing out on important information. So it's nice to be told the reason why there's a certain rule in place. And to do our best to keep the words positive. So we don't want to say, no running around, during group. We want to say, let's all stay in our seats during group. Let's all actively pay attention to so-and-so. So we don't want to say, don't be rude. Don't overtalk over Joe. I might say like, no, let's all actively pay attention to Joe so we can hear what they're saying. So trying to reframe rules so it's positive in nature. Making it specific. So we don't want to use terms like, well, let's just all behave. Well, what does that mean? So we want to put it in measurable terms. So it's specific. What does behave mean? What does that look like? So it's observable and measurable. And then if you're in a position to make them visible, so then there's a visible reminder of some of the rules or guidelines. So these are just some examples. So a lot of us will use terms in our classroom, in our groups, in our programming to say, well, we just want you all to be responsible. Again, let's ask, it's really important to be specific. So what does responsible look like? Well, it's follow directions the first time we're asked. It's to be in our seats when the bell rings. It's bringing your materials to the class. What does be respectful look like? It means listening to others. It means raising your hand and asking permission. What does be safe look like? It means that we're going to walk when we're indoors. It means that we're going to keep our hands and feet to ourselves. It means we're going to follow directions the first time we're asked. So students know what to expect. If I say bring material, like be in your seat when the bell rings, more than be responsible. There's going to be a higher engagement when students know what the behavior is that you're seeking. And just remembering that as far as behavioral reciprocation, that the behavior that you're all giving out are the behaviors that we're likely to get back. Just like I was saying, I would go into the detention centers and sometimes I would just go just for an assessment. So I was only going to meet with a individual, and they'd be in their orange jumpsuit, and they'd come and they'd sit with me in an office, and I might just be with them for an hour or two to do a report for the courts. And I was very intentional about being respectful in the sense of I would smile, I would thank them for their time, I would let them know why I was there. I was kind of expressed the hopeful expectation for that hour, what I would do afterwards. So I would explain the information, explain who I was, and stay calm, and I found that the more I did that and showed interest, that they would reciprocate that level of respect. So oftentimes what we put out there, many times students in their capacity, we can try to hopefully elicit, some of that back. Not always the case, as we know, but hopefully it can be somewhat reciprocated. So when it comes to these terms of behavioral change, because some of you in your level might be working with a student who isn't doing their homework, or they're missing a lot of school, or they're talking a lot in class. And you might be asked to like sit and talk with the student to say, gosh, hey, Johnny, let's talk. And overall, the intention and the goal of Beyond Connection, of course, is an ideal behavioral change, so that they do their homework, they show up to school on time, that they stay quieter during classroom activities. So any sort of behavioral change warrants some sort of reinforcement, typically. And this takes you back to your probably Psychology 101 class. So there's the idea of positive reinforcement, negative reinforcement, and punishment. And so positive reinforcement, which we'll spend a little bit more time, it occurs when something is presented, when something is presented after appropriate behavior has been exhibited, so that that behavior can increase. So Johnny does his homework on time. There's some sort of incentive. There's a word of affirmation. There's a sticker. Of course, we want to be age appropriate. Maybe there's an idea like, if you can get your homework in every day this week, there's a reward. Maybe that reward is you get to go spend the last 10 minutes of class reading a book or doing something else you want to do. So basically acknowledging and rewarding that behavior to encourage more behavior. Negative reinforcement occurs when students engage in a behavior to avoid or escape something, so that the behavior increases. So the student rushes to finish their work, so they're not kept in from recess. They could still they're not come from recess to complete it. So again, it still has its place, but it's not quite as powerful as positive reinforcement. Punishment occurs, of course, when something like the student is given something they don't like when they don't do something. So they miss school, they go to detention. They miss school, they don't get to go to the pizza party. So there's like it's obviously more of a negative emotional connection to it, with the goal of like, oh, I don't want to miss out on the party. I don't want to miss out. I don't want to go to detention. It's a negative feeling. I want to avoid it. So that's what will make me do my homework. So all of these have a place. All of these can be impactful. But the one that we want to focus a little bit more on is the idea of positive reinforcement. So when we think of positive reinforcement, it doesn't necessarily mean, oh my gosh, now I've got to like spend a whole ton of money getting treats because I just don't have the budget for that. That's not necessarily the case. Positive reinforcement could be, again, words of affirmation. It could be, believe it or not, the littlest things that cost minimal amount can mean so much. Somebody gave me like a 50-cent, card. You could just tell it was, like a little box of little cards. And somebody gave it to me the other day to because I engaged in a series of supervision series. And so like she gave it to me like in the midway through to say like, please keep up the good work kind of thing. It was more detailed. And it was this little card that was just made me feel so good. So it wasn't like the amount of how much she paid for it. It was the fact that she took the time to give it to me, to use that time to acknowledge the behavior, to acknowledge my work, to acknowledge how well I was doing. So sometimes it's the action of a positive reinforcement that brings the positive feelings. So that's where we want to think about how can we implement positive reinforcement with the students and the work that we're trying to get them to do. We want to make sure they're age appropriate, and we want to avoid partial praise and teach teachers to avoid partial praise, meaning, well, that's great that you got your homework in today. I don't know about last week, but today I'm glad you got it in. Or well done for getting in your seats finally. So it's kind of like a letdown of a praise. So that's the praise is there. There's still a little bit of a, well, you could have done it better kind of feeling to it. We really want to stick to as much praise and positive reinforcement as possible. So other examples could even just be a smile, a thumbs up. I'm seeing you when you do this. You got your homework in on time, giving you a nod of recognition. That can be powerful. Verbal praise. Thank you for participating. If we're trying to change the behavior to get that student to speak more in class, to answer questions, to get out of their shell, I'm going to be more intentional about saying like, thank you for, that was a really solid question to present to the class. We talked about tangible rewards, activity rewards. So maybe if we're all sitting in class at the beginning of before the bell rings, then we get our last 5 minutes to chit chat with our neighbor. So we can talk about activity rewards or even group rewards. So if everybody reaches a goal together, then they receive a goal together, a reward together. And so when you're working with your students, it's really nice to practice affirmations, and in a sense, it goes beyond compliments. So it's one thing to say, oh, nice outfit today, or that's good job today. We really want to be as specific as possible because it's going to be more personal and meaningful. And this is not to say, hey, I do it. I say, well done. I'm like, good job. I say it all the time. Sometimes though, if I'm working specifically with a student that needs a little more support, I'm going to be more intentional by saying, wow, that you demonstrated such creativity by adding such bold colors with this art piece. You demonstrated, such great, such organization, obviously time management, because you made it on time every day this week. You were able to make it happen. There's something about being recognized for the specificity of the behavior that's going to be received. And a trick that I do as a therapist that, just to present to you all is like, I like to start off with the term you or your. So I might say here like, oh, Veronica, I think that it's awesome that you've been paying such good attention with me for almost 2 hours. Versus Veronica, you clearly, this important, you really do care about learning about trauma-informed care because you care about how this could impact your students. Yeah. When I say I think, it's kind of reflecting my opinion. Like I think Roberta thinks that Veronica's awesome. Versus you, Veronica, are awesome. Somehow is internalized a little differently. So just as something to think about, maybe to practice with family members or with friends, like you did an awesome job with cooking dinner yesterday or today, versus I think this is the best meal you've ever had. They're both fantastic. But just I kind of notice when we use the words use or yours, sometimes it does feel a little more personal and it's internalized a little differently. So when we're using verbal reinforcements, try to be practice immediacy as much as possible. So as soon as the behavior is demonstrated, be genuine. So don't say, oh gosh, I think this is one of the best projects you've ever done, and you really don't think so. Maybe comment on something else, like you really have demonstrated a lot of determination to get this project, just exactly as you want it. So we want to be genuine and authentic when we give feedback. And so just as we do positive teaching or positive reinforcement, to focus more on the positive statements. There might be an area for improvement, and that's okay too. We just want to balance it. Being descriptive, being brief. We don't have to be too wordy when we see something. Sometimes those short comments are just as impactful. consistency, as we talk about, and just also too, when we work with our parents, sometimes when it comes to the children who get called a lot to the school for behavioral issues, parents are so accustomed to like, uh-oh, what did they do now? And wouldn't it be nice to surprise them with like, actually, I'm calling you because they did something actually really impressive this week. They helped out a student with their math, or they actually did help their teacher after school put together the class assignments. So it's okay to even talk to students, to parents about the positive things you've seen in the students. And then thinking about self-praise too. So it's like, because we want to, like, we're giving a lot. You are helpers. You offer a lot to each other, to the students. You're working with a big student body. And to stop for a moment and give yourself kudos, because this is not easy work. If anybody says like, oh, all you do is talk to students all day, it's like, are you kidding me? This takes energy, and it takes a lot of mind, body, spirit work. And so to just give yourself that praise too at the end of the day, to say like, all right, maybe Johnny still didn't complete their homework, but they they really though have increased their social skills, and they smile at me when I see them in the hallway. So recognize those small successes for ourselves. And this is where I just want to spend the last couple of minutes talking about that importance of self-praise and how it might tie into self-care. And then we can talk a little bit about this. Because as a helper, cannot emphasize enough the importance of self-care. We hear that term all the time. We hear it on social media, we hear it on commercials, we hear it in books, but really, what is it and how does it apply to the work that we do? I love this poster because I think it just really says so much, because self-care isn't what people think it is, often what most people, non-helpers, think it is sometimes. They think self-care is that once in a while bubble bath or a spa day. That's my self-care. Or I'm going to go shopping after work. That's my self-care. And what I'll say is that those are ways to self-reward, to give yourself treats. But what really comprises more of self-care is something that's more habitual, something that's ingrained in part of what you do on a regular basis to stay well. So what is self-care is actually setting boundaries, to say no when being overextended, to go to therapy perhaps on a regular basis because of what we're exposed to taking care of our physical health on a day-to-day basis. So getting enough sleep, eating well, etc. Learning to ask for what we need resembles self-care. So as much as we all love our bubble baths, ice cream, but we don't get to do that every day, unfortunately. Most of us don't. But what we can practice every day are just some things that we can integrate in that 5, 10, 15 minutes, or allotting for a full night's sleep, or taking a moment to breathe. Those would be more illustrative of self-care. And to remember that self-care is not an indulgence, because as helpers, sometimes we think like, I don't have time, that's being selfish. I'm going to go to the spa on Saturday so I can put in the 12-hour day today. I don't have time for self-care. That's too much. And we can't operate on empty. So it's not indulgent. It's not selfish. It is not going to the spa on Saturday. It is something to build and maintain our resiliency on a day-to-day basis. And figuring out, how can I carve out time in my busy life to do this, because it's important to prioritize it. So remembering that self-care becomes part of your routine. Ideally, get to the point where you miss it if you don't do it. If you go for a 30-minute walk almost every day and you don't go for a walk 3 days in a row, you feel like, hey, I missed my walk. So it becomes part of your routine. It's something that helps you stay centered, even if it's for 5 minutes a day. That's my time to drink my coffee, to look out my window, to take a few breaths, to collect myself. So stay centered. It's to connect your mind, body, and spirit, and it's preventative in nature, meaning that we want to prevent burnout and exhaustion, because when we're working with students and their energy and their stories, and we're trying to put together programming and connect mental health services, and we don't take care of ourselves, we're going to be burnt out before we know it. And burnout is not good. Burnout is not, I just need a vacation. Burnout is, I don't like my job anymore. Burnout is, I'm finding hard to enjoy other things in life. Burnout is, it's taking a toll on my relationships. Burnout is, I'm feeling cynical about what I see in my job setting. So all of those things that we do for self-care is really going to be helpful in the long run to help you love your job or your work. It helps to manage our own personal triggers. So if we're working with a student who brings up things that maybe we've experienced, we want to be able to manage that through self-care activities. So maybe journaling, maybe meditation, maybe going to the gym, doing something with that so it doesn't sit with us. It helps us to stay present. That's how I'm present here with you all today. Like, I purposely got up to do a 30-minute little walk on the treadmill. I purposely ate breakfast. I purposely didn't rush so I can stay here and enjoy what I'm doing, stay present. I'm not, super frazzled to actually do the best I can in this workshop. And it just, again, helps us to model and maintain, what we get to do. So as just to brainstorm a little bit, and then I'll kind of just check in with you all to see, kind of what you all do for self-care, is as starting the new school year. It's a great opportunity to think about on the 28th or 29th, what do I want my life to look like? What is that routine going to look like that promotes the best routine, best energy, best self-care, and energetic as best as I can routine for myself. So starting the new year, starting the new school year is a great time to assess if we need some help in any of these areas. To recognize, like, what can I do to ensure enough sleep? And I'm going to talk about sleep for hours because in grad school, I worked at a sleep lab. So I would work with people with sleep disorders and work with people who didn't get enough sleep and saw the impact physically and emotionally. In fact, personally, I was working graveyard. It wasn't getting a sleep, ironically, working in a sleep lab. So for those couple years, I got depressed. I gained about 20 pounds. I just was irritable. There's so many things that not getting enough sleep can impact. So what can I do to maybe stop an hour earlier in my day to just transition to a more relaxing night? Watching our food intake, watching our physical intake, even if it's for 15 minutes a day. What can I do just to move my body, stretch it perhaps? What can I do to ensure connection for myself? We saw in the video the importance of connection. We saw in the CDC report the importance of connection for our students. But what are you doing to stay connected and spending quality time with loved ones? How do you nourish those personal relationships? So what can we do in our self-care plan to ensure, like, all right, what can I do to spend some quality time with a spouse, with a child, with a friend on a regular basis? Our mental health. So what are we doing to stimulate and to attend to our mental health needs? What activities can we do outside our work that's going to create creativity and enjoyment and stimulation? Maybe it's learning a new dance. Maybe it's learning on a consistent basis a new language. It's learning how to cook. It's learning how to knit. An activity that's going to just help you just feel stimulated, but not burnt out. something that's sometimes it's in those moments that we are the most creative. And then setting boundaries so we're not overexhausting ourselves, and just to stay proactive on our mental health when we're starting to feel down, depressed, stressed. What what is the clue that we know we're getting stressed? And then what can I do to intervene with that? And to also recognize the importance of spiritual practice. So it doesn't mean religious, it doesn't mean any woo-woo stuff, but maybe it's just thinking at the end of the day, what are 3 things I'm grateful for? Taking a few moments to just breathe. Maybe it's using a gratitude journal. Maybe it's just doing some reading that really feeds your soul. So something that brings you peace. And maybe it's nature. So something that you can do that balances you. And then of course too, like making sure that emotionally that there's a little difference from mental health, because mental sometimes means this the mental kind of like the stimuli, the activity, and this is like ways to deal with again that depression. What can you do to recharge and reset because what we do is daunting. This is very important. So as we start to wrap up, it's just really thinking that you just define your own formula. So everyone is different. So what works for me may not going to work for you. So, uh, but at the same time, it's also great to share ideas. I love hearing ideas from friends to say like, oh, I didn't know there was a free yoga class on Thursdays. I think I'll go check that out. So recognizing that it's okay to just, be able to collaborate with others in your self-care intentions. Being patient with yourself, because knowing that new habits take time to form. I started doing my 30-minute walk January 1st. So now we're in August. I finally all right, that's part of my routine. And that's part of something I miss when I don't do my walks in the morning. And so but it took time. I didn't like doing it at first. I didn't like getting up half hour early. I didn't like it at all, but now I like it. It's part of my day. And then just what can you do to plan that out for the new school year? Maybe it's something you do with your class together. Maybe it's something you do with your colleagues when you get to work. Maybe it's just something you do on your way to work. Just something that works for you. So we'll stop for questions in a second, but I just wanted to show some other great resources that are related to trauma-focused care. We've got a couple of good books there. We've got the Tough Kid book. We've got the Skills for Psychological Recovery is a free PDF. I put the link there at the bottom. So it gives you, what I like about the Skills for Psychological Recovery, which might help in your work, is it gives you almost like some scripts. Like if you're dealing with maybe some suicidal ideation and you're like, oh, I don't know, this is a little out of my scope. This gives you some ways to navigate these conversations, that maybe where you can bridge the student to other mental health. But if you're right there, maybe it's just that student just needs a conversation then and there. The Skills for Psychological Recovery just help build that framework for you. Trauma-informed care and whole brain teaching, and SAMHSA, of course, has some great resources too. And then, of course, just to remind you all that as a practice, we are here for you for those mental health needs to bridge. So now that you're putting your collection of resources together, you know one resource already, and it's free. We have a contract, so your students do not have to worry about paying or anything. So all it sometimes takes a couple weeks to get things rolling. But once we do, then students usually can meet with their therapist once a week for the school semester. So I'm going to stop my page for a moment. You just heard me talk for a long time, so I'm going to stop talking for a moment and just see, just open for questions, comments, anything or just ideas you'd like to share with each other. Curious, since we did talk a little bit about self-care, what are some things you all do to practice self-care, especially as you embark on a new school year?
I'll go first.
All right, thank you.
I do a couple of things, and I certainly can improve upon my self-care for sure, but I like to go to the gym and just get out some energy there. But also have to kind of engage in something creative and whatever that might be, but being in the creative process just kind of lets me not think about all of the things that I think about all the time sometimes.
Yes. And I love what you said. Like there's always, areas for tweaking and for your because we get busy. So sometimes we have to refine things and kind of see it, just come back to it. And like you, that I will say that's one thing that I want to work on the second part of the year is creativity. Because I feel like, what am I doing that's creative? That's not work related. And so I'm thinking about putting together like a little like fun like learn little videos, those little funny videos that people do on Instagram and all those. Like, I want to learn how to do that stuff. So I love it. I definitely want to broaden my creativity too. I go to Reiki once a month, daily exercises and crafts. Yes. Oh, yes.
I try to get outside
Mm-hmm.
and just make sure I get some fresh air, get some sun.
Yep.
I did want to ask, would you be willing to share the self-care image? I'd like to hang it up in the office just as a little reminder for all of us.
Sure. I'll share it with you, this PowerPoint, and then I'll look for where I found it, because honestly, I
Okay.
found it on just like a website.
Oh, perfect. Okay.
So I'll just send you the link to the website too. I probably should have given that website credit when I posted
We won't tell.
it.
You're
Okay.
good.
Yes, I know. I'm so intrigued by Reiki. And in fact, it's so funny because on my list to try out is a yoga and Reiki class that's free. And so that is definitely like on my things to check out. So I too, I'm like so intrigued by Reiki. So, and yes, going outside helps tremendously. The sun, vitamin D, breathing in, being close to nature. Because you're right, we're under fluorescent lights most of the time. So whatever we can do to take some fresh air.
I
So,
start my morning slow.
yeah.
I sit and just I just start slow.
So not feeling rushed, not feeling frazzled, just kind of having your time. And so that sets the tone for the day. So working in the yard is wonderful. There's something very being like having like the dirt and the ground, they're just being close to nature. It could feel very nurturing and could feel very meditative. Yoga and meditation, making sure to plan fun things. Absolutely. And I'm all for that. Like I plan a date night with my husband every weekend because I think it's like self-care is, yes, the day-to-day, what we do with our exercise and our food and meditation, also those fun things to look forward to as well. So those rewards. Yep. We're not moms doing or anything, just you. Gym. Wow. Consistent gym goer here, Veronica. Make crafts almost every day. Oh, I love, yes, skin ritual. That's awesome. Oh, that sounds very self-soothing. And then you get the beautiful benefits from it too. So, well, my goal today was again to hopefully just to recap, remind us, of some of the terminologies with trauma, uh, our big T's and our little T's, and how they're both very impactful on with our students, and how it is important for us to look for those signs and symptoms, that we talked about, our daydreamers, our students who are not eating, our students that maybe just need a little intervention, a conversation, hearing them out a little bit, and how that intervention can be very impactful. And if we find that maybe that student, now that you've engaged them, could benefit from something a little more, than being that bridge, because they're going to listen to you because now they've trusted you to potentially follow through with your recommendation. So you serve as that beautiful, beautiful like connection, and then you're there consistently to see them through and to be there on a more regular basis, to smile, to check in, to give them that nod in the hallway, to let them be seen, to let them be to not feel invisible. And then we talked about ways to maybe look at our environment, to make it a little like warm, inviting, posters, books, things that promote positive mental wellness. We know just some of the things that maybe we can talk to parents and other educators about. And then we know now some of the language that are the tenets of trauma-informed care. So believe it or not, we actually did cover some good points today that hopefully we can sprinkle in. And importantly, we talked and remembered the importance of self-care. So to be able to do this work, we have to just make sure that we maintain resilient and that we maintain healthy and solid so we can do the work we do. So in that, I want to thank you all for hanging out with me, spending your summer day with me. And I hope now that you have some plans for some self-care coming up this weekend. Self-reward. So
Thank you so much.
Thank you, Sarah.
Really appreciate you spending time with us today.
Oh, I appreciate it. So I'll make sure to send this to you and the PowerPoint and the resource. So
Great.
Sarah, is it
Thank you
okay
so
if I
much.
send this to you?
Yep.
Okay, I shall do
Get it
that.
out.
Well, in that, thank you everybody, and have a wonderful, wonderful rest of your day. Take care.
Yeah. Thank you again.
Thank you.